am Dr. Suvarchala, Scientific Director with ZIVA Fertility Centers. A varicocele occurs when a bulge results from enlarged veins inside the scrotum. The swelling typically resembles an enlarged bulge above the testicle without discoloration. So let's try to understand what this is. The Pampini form plexus is a group of veins inside the scrotum. These veins help cool the body before it travels to the testicular artery, which supplies the testis with blood. If the testes are too hot, they cannot make healthy sperm, and sperm health affects fertility. So it is essential that the veins can cool down the blood. Most people with a varicocele do not have symptoms, but some may experience fertility issues. So when someone has varicocele, they may also experience swelling and tenderness in scrotum. We'll try to understand the causes and risk factors. A varicocele occurs when veins in the scrotum become enlarged, like I said. Every vein has a valve that prevents blood from flowing backwards, but sometimes the valves don't function properly. This causes blood to flow back, damaging the vein and causing swelling. So research published in 2014 that you see on your screen shows that smoking may be a risk factor for varicocele as it damages a person's blood vessels. The same study found no link between alcohol or occupation and varicocele. So it's very important to infer that smoking causes varicocele. Very rarely, a growth in the stomach can also put pressure on the veins, causing a varicocele. This issue is more common in men who are more than 45 years old. How do we diagnose it? Most men who have varicocele do not notice anything unusual, although some people report a heavy sensation or occasional throbbing in the scrotum. Many of these affected don't even know that they have varicocele unless they experience infertility and examination after that. The doctor can often diagnose a varicocele during a physical examination by looking at the scrotum and feeling for lumps and unusual blood vessels. And if they do suspect a varicocele, they may order an ultrasound, which is a painless imaging test which allows your doctor to see the veins inside the scrotum. If you have a problem with infertility, then semen analysis may also be required. Treatment involves embolization. It is a surgery that temporarily cuts off the blood supply to the scrotum. During embolization, the doctor will insert a needle into the vein, usually through the groin, and sometimes they may insert a needle through the groin. The needle helps the doctor access the vein in the scrotum and block off the varicocele. Then the next option is surgery. A doctor can surgically remove varicocele also by blocking the blood flow to the damaged vein. This surgery is called varicocelectomy and it requires anesthesia. If you wish to understand more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.